and AIDS remains a significant health challenge world over, and Zambia has not been left out. In an effort to address this challenge, St. Francis Home-Based Care in the Catholic Diocese of Livingstone was established to respond to HIV/AIDS-related cases in the 1990s. Run by the Franciscan Missionaries of Africa, a faith-based organization provides holistic services to people living with HIV and AIDS, tuberculosis, malaria, cancer, among other illnesses. The facility also seeks to reduce poverty levels through care and support, health education, economic empowerment, and capacity building. Sister Mary Courtney, who is the sister in charge at the facility, explains how the facility was established and highlights why the community members needed the services they offer.
And we had to make a plan of action because the community were really depressed and concerned about how they were going to care for their sick, because the hospitals and the clinics were overcrowded and patients were discharged prematurely. But these patients were sent home and they didn't know how to care for them. So they asked us, can you help us? So together we made a plan, and they helped us to select volunteers in the community. And after selecting 96 volunteer care supporters, we trained them on HIV/AIDS and basic nursing care.
Programs Officer Ms. Constance Miova says the facility has catered to 1,000 clients, offering different care services to ensure people live happy and healthy lives.
Only home-based care, but our activities including adherence, treatment, support to the people that are living with HIV, including children. And we have about 1,800 of them. That is 517 males, 1,283 females. That includes children. So to help us monitor adherence, we have 24 care supporters. We call them care supporters before they were called caregivers, because they basically provided the whole care. But this time, due to the changing face of HIV, people are getting better. Our family members are doing the basic care.
Being the tourist capital, Livingstone has seen a rise in the number of persons living with HIV and AIDS over the years. Clinical Care Officer Mr. Derek Kalimbwe explains the prevailing cases of HIV and AIDS in the district and how interventions like these have helped curb and reduce the mortalities and the spread of the virus.
Okay, some of the achievements made so far in terms of HIV/AIDS in our district, there are a lot. Like I said, in Livingstone, when we were starting from where we are coming, the 2010 census was showing us that Livingstone we were at 25%. Okay, that is in 2010. But before that, Livingstone was at 29% in terms of HIV/AIDS. So the rates were very high. But now, as I'm speaking to you now we are concentrating in the hotspots. For St. Francis, these people have worked a lot. You see, one thing which I need to mention to you is that St. Francis are not only into offering palliative care and also the issue of other home visits and the physical and emotional supports, they are also dealing with mental health.
The beneficiaries have 1,000 stories to tell. One of them, Miss Mlinga, not her real name, explains how she was in denial after testing positive to HIV and AIDS. She says she found it hard to accept her situation, but through the help and counseling from St. Francis, she pulled through and is now in good health.
So naro parafetire masangre no burere bansangre nabo shasimine natwai ngere burere barisashani inenshenda yenda namba cyabashani so bari bakashana abalepita nama t-shirt yaremba pat St. Francis so narishire beta nata Nera tupitia kuoneke milimu ya shunguru kama community. Safa baishire kuoneka. Fema ishire website nda ma t-shirt mfere. Nishita nshimugomba mu community. Mle shunguru ka. Safa baishire tampa ukundonderera. Nchito isho babomba. Safa randonderera. So nasata. Nda ukumijoina. Chiba shaina ngo mafuncha shaina abantu. Usenda tayo kujoina tatukana. Safa na ishire bagata. Matema family bibumba bimba. But na report situation ya so. Oyo ndepi kama ndechu but nshira asumina. Uwamba kwa ati situation na isangemu. Shache tekere. Namba fila chitika turi bantu. Antu nshika rameka. Tuwajiba na rashikuri bantu. Umanjika na wapano panganda.
Ms. Mlenga, inspired by her own story and the help she received, has now given herself as one of the caregivers and facilitators at St. Francis. For other beneficiaries like Mr. Tembo, also not his real name, he shares his gratitude for the help rendered to him by St. Francis.
Ono baba kutwetera clinic yaba ababajo kuba sister Mary then 40 ba sister Mary inji bakatubasha ku program bali kutwetera misamu barubona kuboto ndani kuti yinke kuchibatera kule atikambuka program aba sister Mary twaji wa kupona kusirinji muchindi amisamu yabo bali kutupa chama rusu yonse kusirinji muchindi.
Another beneficiary appreciated the services offered by the center and further encouraged people living with the virus to adhere to the HIV and AIDS treatment and seek help from facilities like St. Francis.
workshop amenzo tipa sakutipunzisa monkalira mu bantu. Then 3 uspeskati mukombolera mweve ngati muzatu atwala tezokangiwa kuti timutenge tubeke ku hospital sababu tamtambalira mu nyumba. Koma mchifundo cha St. Francis mweve zobwera kutenga ngati report nizobwera kutenga muntu uja kubeka na hospital ya mtambala mkwala pakati mkakola mkola. But about dwala mema yakabigera nsoni ba umacheta nya usibeda bapacha St. Francis kumweta kwa counseling ndio amana kumwana mkwala abevu bakala ko mga matakali mwaita ya matupia atusi.
St. Francis has dedicated men and women that do door-to-door visitations to check on how their clients are doing, offering them continuous counseling and words of encouragement. Despite the good works that the facility is doing, they face numerous challenges that cannot go unnoticed.
Challenges which are there with the patients, you find that in our facilities, the issue of structure, patients may not feel comfortable with privacy because of the limited structure which is there. Some of the health facilities actually have got only 2 rooms. So you remember the population is growing and the services are also growing, but we are still maintaining the old facilities which were put long time ago. So you find issues of confidentiality, the privacy issues are compromised.
Presently, the notable changes I can talk about the diminution of donor support.
Okay.
Yes, the mental health medication is very expensive, and also there is no uptake of mental health services by government. Yes, so we are still advocating that mental health cases can also be allocated the same amount of medication as these other cases. Yes.
To ensure efforts of goodwill and service like that of St. Francis are encouraged, every well-meaning citizen is encouraged to take it upon themselves to reach out and offer help in any way they can. The call to government is to ensure that they take a lead in commending charitable works like those of St. Francis home-based care.